I am going to share my screen. Can you all see the slides? I always need to check.
Not yet.
Not yet.
Oh, really? What did I do wrong? All right, let's back up and do this again.
Always a journey.
It's every time I think I have this down pat.
No kidding.
How about now?
Yep.
Okay, excellent. Excellent. Well, good afternoon and good morning to some of you who are not on Eastern time. Welcome to the launch of our volunteer and faith-based respite learning collaborative. As many of you know, I'm Jill Kagan, Director of Arch. We decided to launch the Learning Collaborative to really serve as a community practice for the Respite Network. Many of you have already been engaged in supporting or providing volunteer or faith-based respite for a number of years now, either through your lifespan respite grants or your state respite coalitions or your agencies. And we wanted to be sure that we were providing a forum for all of you to connect, to share your great work. And for those of you who are just getting started, we have some resources in this area that I really just wanted to make sure that you were aware of and could use as you saw fit, and that you will all continue to participate in this group to share your successes and challenges and your progress around volunteer and faith-based respite learning. If you'd all please, we don't really have the time for you to all do individual introductions, but if you wouldn't mind putting your names in the chat, and along with your name, please include your agency and the state that you're from. We'd like to welcome many of you I know who are new to the Arch Learning Collaboratives and maybe even new to Arch. There are quite a few of you who are planning to be here today who are partners with your state lifespan respite grantee or members of your state respite coalition. And we're really very, very glad to have your participation in this community of practice. Also, if you don't mind, when you're entering your name and your state, just let us know what you're hoping to get out of this learning collaborative. So we'll have some written documentation that'll guide us for future meetings. During this presentation, short presentation that I'm going to be doing today, I will spend a little bit of time, as I said, reviewing Arch resources that you can refer to. And whether you're new or even if you're experienced and looking for additional ways to improve and grow your services, I think these resources will be helpful. But I do hope that we'll spend the bulk of the time today brainstorming future topics for the collaborative, and also have some time to discuss how you would like to format and schedule these meetings going forward. I'm going to launch a quick poll just to get a sense of how much experience you do have. This has always been helpful to know who our audience is and make sure that what we're doing is meaningful for all of you. So just let us know, are you currently implementing or funding volunteer or faith-based respite program or service? You're not currently, but you're considering, or if you're actively in the planning stages. I'll give you a couple of minutes to respond to the poll. We have about 2/3 of you who have responded. Anybody else want to last seconds to respond to this poll? We'll give you 10 more seconds. Okay, here are the results. 7 of you, or 28%, are currently funding or running volunteer faith-based respite. That's wonderful. We're going to turn to you for guidance and experience. About twice as many of you are not currently, but you're considering, and a few of you are in the planning stages. So that's a really nice mix of folks that will be able to share their experiences and their services. On the next few slides, as I said, I'm going to be sharing information about these following resources. We recently updated and streamlined the Volunteer Respite Manual. And before I forget, I want to let you know that we do have hard copies of this document to share. Not an endless supply, but we could share with you 2 or 3 of them if you think they might be useful in your own work, if you're doing volunteer training, or if you have faith communities that you're working with, maybe they'd be interested in having a copy of the manual, or if you just need it as a reference guide that you can keep on your shelf. I'm going to be sharing with you more information about the Arch Innovative and Exemplary respite services, because this has really helped us to identify volunteer and faith-based services across the country. We also have a number of archived webinars that will provide additional context. And then some wonderful, and this is probably going to be the most useful to you, tools from state lifespan respite grantees and state respite coalitions on volunteer and faith-based respite. There are so many of you out there who have awarded mini grants to community or faith-based agencies to help you provide respite, and you've generously shared your tools with us. And then I just quickly at the end want to mention, if you're not familiar already with the respite provider training pilot that we're just beginning to undertake, I'm going to share a little bit of information with you, because even though it's not going to be designed specifically to train respite volunteers, it certainly could be used for that purpose. Okay, let's start with the Volunteer Respite Manual, and I hope some of you have at least had a chance to look through this online. It really provides a very detailed step-by-step guidance on starting a program or implementing a volunteer or faith-based program, and it covers everything in detail, from volunteer recruitment to management and supervision, retention, liability and risk management. It also has strong sections on the planning phase. That includes conducting a needs assessment, thinking about performance measurement before you actually start implementing the program, how to identify costs and revenue streams, and even some suggestions for marketing your program or service. While this particular manual is not a training manual, nor does it recommend or provide specific training curricula, but it does include a chapter on volunteer orientation and training, and identifies the important components that you would want to make sure were in any training curriculum or orientation approach that you select, so that you're lined up and covering all of the right topics in that training or orientation. Along the margins of the document are lots of wonderful supplemental information, including links to national volunteer organizations, not necessarily always respite focused, but they might be caregiving or mentoring programs, or other avenues that provide lots of useful tools and resources in general around volunteer and faith-based services. And then the article links to an Arch web page that includes appendices with lots of sample forms, especially from a series of program case studies that we've included throughout the manual. That's in-depth descriptions of some volunteer respite programs that we've identified. And the appendices also include links to policies, sample policies and procedures, and even a few sample handbooks, if you get to the point where you're ready to develop a program manual or handbook. And throughout the document, we've also sprinkled important information about considering volunteer respite during the pandemic, because we're certainly not out of the pandemic yet, and there still are some major issues of concern around volunteering and providing services generally that we should all be aware of. And all of this document and all of these appendices can be found at the link at the bottom of the page. Many of you may be familiar with our initiative to annually seek innovative and exemplary respite services from across the country. And I just wanted to demonstrate how this will be very helpful as we move forward with this learning collaborative. We've undertaken this initiative for the last 3 years. And what we're looking for when we're looking for innovative and exemplary services are well-established services that are evidence-based or evidence-informed, that appear promising, services that are trying new service models or targeting especially hard to reach populations, and further that they have some preliminary data or at least a plan to collect data that will demonstrate benefits to caregivers, care recipients, or family systems. And of course, we're looking for programs that demonstrate innovation. The goal of this effort is to have a database of such services that we can share with all of you and with the public. And those of you who are looking for services worthy of replication. To date, we've identified almost 30 respite services that meet the criteria for selection. And a number of them are volunteer and or faith-based. And so I wanted to point those out to you here. The Caregiver Volunteers of Central New Jersey and the Caregiver Respite Program at Lifespan of Greater Rochester were also included as in-depth case studies in the volunteer manual. So there's some connection right there. If you want to read more about these other models, you can visit that link at the bottom of the page. There you can find short descriptions of the program, as well as links to a webinar and a conference, international conference presentation, again, where we go into more depth about a few of these programs. And even if the other innovative and exemplary programs are not identified as pure volunteer programs or services, many of these community-based services utilize volunteers extensively and also have resources to share. So I urge you to go to that link and visit more about the innovative and exemplary services. And I really want you all to know too that we will be opening up the application for 2022 selection of innovative and exemplary respite services probably in December or January. And we would love for you to submit an application if you have a volunteer or faith-based service that you think has been around for at least 3 years and has demonstrated some innovation, or if you're collecting good data, we'd love to have you apply. Or if you're a Lifespan grantee or coalition and you're aware of programs in your network, we would really encourage you to invite them to apply. Archived webinars. This first one, Volunteer Respite, Putting the Pieces Together, I really encourage you to listen to this first webinar. It provides a really excellent overview of volunteer programming. Our presenter was Mary Jo Caruso, who ran an exceptional volunteer initiative in Pennsylvania for many years. And she then also directed a statewide initiative in Pennsylvania funded by the State Maternal and Child Health Program to expand and encourage development of volunteer and faith-based respite initiatives around the state. And one particular component that I wanted to mention right now, and this certainly would be a possible topic for a future learning collaborative. It's a component of volunteer programs that we have found to be a critical best practice. And that is the time and effort that's put into matching volunteers with families. This was so clearly demonstrated in Mary Jo's program and also in the Caregivers of Central New Jersey's Alzheimer's Respite program and many others who have been able to retain volunteers over very long periods of time. Anywhere from 5 years to 20 years, some of these programs have been able to retain their volunteers. So we know that it's a worthwhile component of a volunteer program, and it's worth taking the time up front to make sure that the volunteer and the family are appropriately matched. I would love to, at some point, have a more in-depth discussion about that component. The next webinar, Respite in the Faith Community, is a little bit old. We held it about 10 years ago, but there are some really wonderful ideas that are still relevant and I think would resonate with all of us. And that webinar also features some excellent examples of faith-based volunteer efforts. So if you have a chance to listen to that webinar, take a moment to do so. And then finally, I wanted to introduce, for those of you not familiar with it, the concept of time banking. I just want to mention it again as a possible strategy, and maybe this is a topic for a more in-depth discussion at a later point. Edgar Kahn, who, if some of you go back a way with us, was a keynote at one of our national respite conferences and the founder of the International Time Banking Initiative. He wouldn't be happy with me calling this a volunteer effort. He really better describes it as a form of currency through bartering, where an individual donates time to provide a service for another person and then banks that time for services that they might need from someone else in the future. It's a very workable concept for respite and caregiving support. And there are a few community-based programs around the country that are successfully utilizing this effort. It's also been demonstrated to be a wonderful intervention for dealing with social isolation. It really emerged during the pandemic to be critical during that time. We're really excited because our partners at the Break Exchange have just discovered time banks on their own. And so we're going to be co-hosting a webinar to revisit this topic with new leadership at time banks. And that webinar will be held on November 16th. We haven't started publicizing that webinar yet, but keep your eye open for an email with the details on how to connect. Of course, I'd be remiss if I didn't share with you this very important web link at the bottom of the slide that takes you to tools and resources developed and generously shared by our own network members. And I want to point out just again a few of these to you, but there are many other examples on this page as well. South Carolina's most recent initiative has been around break rooms in faith communities that provide respite in congregations so that folks can attend a church service. South Carolina Respite Coalition has probably been doing faith-based respite or talking about and working with the faith community for longer than anyone else I know. So they're a wonderful source of information on faith-based respite. And they're also very open right now about sharing some of the challenges they've been experiencing with break rooms. So we just have so much to learn from their work in this area. Alabama, again, a number of years ago, developed this toolkit for volunteers in faith communities, but I think it serves as an excellent model for perhaps developing something similar for your own networks. The Rhode Island toolkit supporting family caregivers through nursing students. And I think I must have skipped over my innovative slide a little bit. I'm going to go back to that one because I wanted to, I did mention Caregiver Volunteers of Jersey and the Caregiver Respite Program at Lifespan. But these other programs as well, for example, Home Away from Home and Rhode Island Care Breaks, both utilize student volunteers. And this is a new and growing way of expanding respite options using qualified providers that families really trust and feel more secure in using. Rhode Island has expanded their program, I believe, to 5 or 6 nursing schools at this point. So they've done quite a bit of work in the area. And so they've developed a toolkit on the model that they've been employing across the state. And that's available on that link on our website. Hawaii, the former Hawaii Lifespan Respite grantee, was so enamored of the time banks approach that the state legislature passed some legislation that would allow the state to proceed with time banks for respite. And so they engaged in a very in-depth feasibility study. Unfortunately, Hawaii was not successful with a continuing federal grant, so they weren't able to implement the time banks initiative. But the feasibility study provides so much groundwork on how we could move forward with a time banks approach to respite that I think it's another resource worth knowing about. New York State, which has also done so much around volunteer and faith-based efforts, they've awarded a number of mini grants to community and faith-based organizations to expand their respite options. And they've done that through using the REST model of volunteer training, and also in their good work made sure that they were collecting data on this effort. And so this particular resource that I provided is an in-depth evaluation of using the REST model across New York State and through some of the funds through their Lifespan Respite Grant. And Tom Caprio, who was the evaluator for that program, is a member of our Committee for Advancement of Respite Research, and he presented on this model at our Respite Research Summit. So again, if you're looking for information about how to evaluate or collect some performance measurement data on your volunteer or respite service, I would strongly advise you to take a look at that tool. So those are just a few of the tools that are up on the website. And then finally, as I mentioned, I just wanted to let you know about this respite provider training and recruitment pilot that we're just launching, and very, very excited about it. ARCH is partnering with the National Academy for State Health Policy and the Respite Care Association of Wisconsin. The National Academy for State Health Policy is the lead, having received some lifespan respite special projects funds from ACL. The first thing that we did was convene an expert work group, and we reviewed existing well-established national curricula for direct support workers and other frameworks. And with the expert work group came up with a new set of core competencies for respite care professionals. And they certainly are competencies that could be applied to training volunteers to provide respite as well. And you can access the competencies at that link. What we then did was take those core competencies that were developed by the expert work group and circulated for public comment. And we're working with the Respite Care Association to align those competencies with their existing online respite provider training. And that's what we're going to be field testing. We've selected currently 9 sites. We hope to involve at least 12 states in this effort. The field test of the training curriculum and also a recruitment campaign will be held beginning January 1st. And if you want to read more about that initiative, this is the link. And these are the 9 sites that have been so far selected. The states are Nevada, Montana, Wisconsin, Illinois, New York, South Carolina, Arkansas, Oklahoma, and New Mexico. And we hope to add a couple of more states before the end of the week, because the project is getting started. Even though the pilot won't kick off till January 1st, we're beginning work right away to help states develop some modules with specific information for their states, and to develop a new recruitment, new innovative recruitment campaign. So again, we're very excited about this effort. I know I have shared a tremendous amount of information with you, but I hope that it has stimulated some thoughts that you might have about topics that you'd be interested in pursuing as a group, or at least to know about them for resources as you're developing your own faith-based respite services. I haven't had a chance while I was doing so much gabbing to really look in the chat to see if there are any questions. But if you'd like to unmute yourselves and ask a question, that would be more than welcome at this time. And I'll look through the chat in the meantime. Anyone have any comments or questions about any of the resources that I shared? Really, I explained everything that well. I'm glad. Again, if you're interested in a hard copy of the manual, please put that in the chat, or even better, email me so that you can send me your exact mailing address where you would like that to be sent. Okay, I do have a question here. What types of organizations will be eligible to apply for the Innovative and Exemplary grant in December 21? And I have to say, this is not necessarily a grant. Last year, we were able to award a very small honorarium to programs that we selected. Normally, what we do is pay for their travel to the National Respite Conference, where we recognize the good work that they've done. But because we weren't able to travel last year, we were able to give some very small cash honorariums to those programs that were selected. I wish we had more funds that would encourage people, but it's really hopefully that you have a program, either a faith-based or a respite program that meets our criteria, and those criteria are on our website. But some of the basic ones, if you have been in existence for at least 3 years, if you have some kind of program manual or guidelines, so that if someone wanted to replicate your program, they would at least have that resource. And then that you're collecting some outcome data or have a plan to collect some outcome data. Again, we're looking for programs that are exemplary. It's hard to demonstrate being exemplary if you don't have any outcomes on what you're doing. So that is a criteria. And then the application itself does ask for quite a bit of information, but we generally also use that to screen applicants and then go in and have follow-up interviews with states to make sure that we have all of the information. Again, anyone that's providing a respite service to a special population, if you're providing respite to military families, if you're providing a unique service in a rural area, again, the focus is respite. The focus is collecting data and having an innovative model. And please read more about it on the website. We have very explicit and well-defined criteria for what we mean by innovative and exemplary. See if we've got any other questions here. You will definitely get a copy of the slides, as always. After every Learning Collaborative, I'll be sending out a recording in case you missed the call, as well as the slides and any resources that we shared. Oh, we have a question here from Cheryl in Nevada. Is there anyone who has developed a workforce from individuals with disabilities themselves? Respite is temporary part-time work, and people on government benefits cannot take FT employment. That's an excellent question, Cheryl, and one we have thought about. And we've developed the training curriculum too, and we're working on developing the training curriculum so that it will be understandable for the largest number of people in terms of the training. But the workforce, I think it's an excellent place to recruit folks from. And there is even a section in the volunteer respite manual about looking to the disability community to find volunteers and suggestions for how to do that. But I'm not, and I'm sure there are programs out there that do that. Off the top of my head, I'm not aware of them, but it is something that we do encourage and have at least provided some guidance on in the manual. Did I miss if I missed your question, please feel free to unmute yourself and ask the question.
Jill?
Yes.
Hi, it's Lori. I don't know. I know some of the grantees worked with the University Centers on Excellence in Developmental Disabilities. And then ACL also funds the Developmental Disability Councils. And they may be, in regards to Cheryl's questions, some places to groups. Each state has a Developmental Disability Council. There are, I believe, only 17 University Centers on Excellence and Developmental Disabilities. But they may be a good resource in terms of meeting with, communicating with, partnering with to talk about a workforce that utilizes people with disabilities. There's also, excuse me, I think I muted in time. Got a tickle. I can never remember what it stands for. Oh, there's the national organization, but I can't remember that. It's AUCD, which is like
That's the Association for University Centers on Disabilities.
That's like their resource center, TA group. And so anyway, I thought that at least might be a place to start or a partnership to try to build or something.
Yeah, no, absolutely. That's a very good suggestion. Thank you, Lori. I know many of our grantees are already partnering with their USEDs, and we've strongly encouraged them to do so. They can provide resources on so many levels, from program implementation to performance measurement. Just so many resources that can be provided. And I'm so glad that so many of you already work with your USEDs in your state.
We have a lot of grantees that work with the USEDs.
Yes, we do.
But I think that the Developmental Disability Councils, it's a little different, and they develop state plans, and I think they're kind of aware of the broader goings on in each of the states and the disability community. And then a lot of, I know at our county level, we have a disability commission. That's not what it's called anymore, but I haven't had enough coffee today, so that's what I'm going to call it.
Well, again, take a look at the manual. It's got a lot of wonderful resources in there and ways to connect with that community as well. There's another question here. Has COVID had a large impact on volunteer programs? We saw them shut down and struggle to recruit, reopen. What is the appetite for volunteer programs now? I think that's true. I think there were a lot of programs certainly that struggled during the pandemic, but then there were others that really stepped in and stepped up to provide services to otherwise socially isolated families that I'm not sure what we would have done if we didn't have those volunteer programs continue to provide at least virtual services. I know that several of our innovative and exemplary programs were able to convert some of their services to virtual services. For example, that student run program in New York State, they use their students to do volunteer check-ins with virtual check-ins with caregivers on a regular basis. And that worked out very well. In terms of what's the appetite now, I think look at the number of people on the call today. I think there's an amazing, I see a resurgence actually in interest for people to start up or reinvigorate or reopen their volunteer programs, especially in light of the pandemic and the role that volunteers play during the pandemic. So I'm encouraged by that. And I think the timing for our starting this learning collaborative couldn't be more appropriate given all the new interest and the plans for opening new services. Elaine in North Carolina says, we're running a volunteer program in North Carolina and it's going strong. Oh, wonderful.
Well, why is that? You think?
Elaine, are you able to unmute and talk a little bit about your program?
I am. Why is it going strong?
Yeah, I'm sorry. I don't mean that. I'm sorry if it sounded rude. It's like, is it because it's so well established? What do you find?
Yeah. Yeah,
Is-
no, Lori, I did not take your question in a wrong way. I just wanted to make sure I was going to answer what you
Well,
were
I just
question you were asking. Sorry about that.
no, that was me because I realized I just like blurted it out. So I was like, why is that?
Well, let me find my video here too. So we actually have a number of programs, and volunteer caregiving is one of them, but they're all volunteer. We're running a transportation program and also friendly visits and in-home, basically a neighbors helping neighbors type program. We've been around almost 30 years. So I think that's part of it. Also, when the pandemic started, we got a lot of exposure through a local television station and a couple of publications. You know, there was a ton of stuff that went online about, everybody wanted to help. We had so many, we actually had more volunteer applications in the first quarter of the pandemic, that March, April, May, June time period, than we've had in 5 years. We just had this tremendous boom of volunteers. Now, not everybody wanted to do an in-home service, and we had to pivot some. Some of the in-home friendly visits turned to telephone calls. Some of the rides to grocery stores became a volunteer actually doing the grocery shopping for them. So I think it was a number of factors. One, we're well established, we've been around. And I think we got on people's radar screen when we weren't already because of some internet and TV coverage that we got. And then I think people were just looking for a way to help. I mean, think back, 18 months ago, everybody was like, what in the world, what can I do, but still protect myself? So we just gave people a lot of different opportunities. And of course, with our family caregivers, that's the population where the care recipients are the most vulnerable. These are people with serious illnesses, maybe, end of life. And so those were the people who were the most protective. But, they switched from visits to phone calls and supported where they could. So we saw a huge uptick in volunteers. Plus, a lot of people suddenly were working remotely and they didn't quite know what to do with themselves. So I think that was part of it. So I just think it was kind of the perfect storm. Now, as things go back to normal, we're seeing volunteer applications trickle back down to normal levels. And of course, we're always trying to find a way to find more volunteers. So just, I think just a few thoughts on that.
Makes a lot of sense. I know on our neighborhood listservs, there was like a whole, how can I help? Hey, I'm going to this store. If you need me to pick something. I mean, it was just an informal thing, but there was a large group of people like, I'm here if you need something. And it was really pretty cool.
Doris, I'm so glad you mentioned this. In New York, the New York State Respite and Caregiving Coalition hosted a respite revival in June for faith communities, and 80 people attended, and it was, what Doris says is that the appetite for reopening respite was huge, in capital letters. So if you'd like to learn more about Doris's faith-based respite revival, please feel free to reach out to Doris Green in New York. In fact, maybe that's a topic we'd like to hear more about at one of these learning collaboratives. People are shaking their head yes. That would be really wonderful. I know which program you featured too, Doris. It was the Alabama program, am I right?
Yeah, we brought Daphne Johnston from the Respite for All Foundation, and she, Jill, the first time I met Daphne was on a webinar for Arch, and I hung up from the webinar and called her. And now
Yeah.
we've done 2 events with her, and we've become very, fast friends. But she has a way of whipping up all sorts of enthusiasm. But there's a large portion of faith communities in the Buffalo, New York area. There's 30 some churches that provide at least once a month respite. So those are the people we were targeting to kind of bring them together and build some cohesiveness and support them in that way. So it was really an awesome day. We rented a big tent and brought them outside. So it was cool.
Yeah, that's very cool. There are some really wonderful models out there that are very similar. The gathering in Minnesota, St. Paul, that relies on 20 or 30 congregations that come together to provide a respite, sometimes 5 days a week in different faith communities around those cities for people with memory loss. There are similar programs in Texas. Used to be called interfaith partners, but I think they're just called care partners now because it's faith communities and community-based agencies that work together to provide respite. So that could be a model that we could spend some time exploring as well, because it's such a successful one. And maybe even bring Daphne in from Alabama. She would certainly get us excited about the volunteer model for church-based and faith-based respite. And I think some of our folks may not have heard her before. She was at our Alabama conference as well. But I don't know if everyone got a chance to go to her breakout session. So it might be wonderful to hear from her. Okay. So we've already got some topics for future learning collaboratives, if that's the format that we'd like to pursue. I had asked people earlier at the start of the meeting today if they put in the chat what they hope to get out of the learning collaborative. And only a few of you answered that question. Some of you just want additional resources. You're specifically interested in faith-based respite. But if anyone wants to address that now, that would be very helpful. We want to make sure, again, that the learning collaborative is meeting your needs. If you'd like to unmute and tell us what you were hoping to get out of this learning collaborative, it would really be helpful. Anyone have any thoughts or willing to share that? Or you're just here for general information and networking, that's fine too.
Here to learn about what folks are doing and what troubles people are having and what we can think about for going forward with the program and how to help.
Jill, this is
Yes.
Robin in
Hi,
Oklahoma.
Robin.
And we are pretty active in using faith-based respite and SIB shops together.
Yes.
And in Oklahoma, and only one of ours has actively started back in person. This was our 3rd month to be in person at a church in Oklahoma City. And they're averaging pretty close to the same number of kiddos on the respite side. We're averaging a few less on the SIB shop side, but I'm, always interested in information on serving siblings and the respite model for children and young adult faith-based respite SIB shop collaborative partnering opportunities.
Great, that's a great topic. I know you all in Oklahoma and I think Wisconsin too have done more around SIB shops than a lot of our other grantees. So I know they'd love to hear about that too.
Great.
Anyone else want to share what they're hoping to get out of the collaborative? Alicia in North Carolina, I find this very intriguing. If you could talk about this, Alicia, you said you started a volunteer respite consortium. And I know you talked a little bit about that at the grantee meeting, and I'm wondering if you could share again what you hope the purpose of the consortium will be and what it's undertaking now. And I know the consortium members are here today to get some ideas.
Yeah, so, and I've unmuted, I'm outside and it's kind of a funky light. And so I'm just gonna go ahead and leave myself muted at the moment. But, or not muted, camera off. But, so yeah, so Elaine Whitford and Lisa Hoskins, they are on this meeting as well from the Center for Volunteer Caregiving. They will be our contractor to help lead and grow and really, help with the foundational work of this volunteer consortium. It was designed, we have programs across the state, and I'm at the State Unit on Aging. So we're in a little bit different role in working with actual providers. And so we wanted to have providers who were already doing volunteer respite, whether it was in adult day settings, whether it was in senior centers or in faith communities, and being able to reach out to those providers that were doing it, and also find providers who were interested in becoming, having some component within their programs that was volunteer based. And so we've been talking about, that's even applies to hospice and home health care, so providers who typically run a traditional business, but they might have a small segment that is volunteer driven and wants to learn more about that. So the point of the consortium and Center for Volunteer Caregiving, as I mentioned, will help. They're forming a steering committee, and then that steering committee will then work on a plan for inviting people to participate, setting agendas, going forward with what we can do right now virtually. But the whole idea is really to provide mentors and seek out those who are interested in growing their programs or starting new respite, volunteer respite programs. We felt like this was something that we at the state could use some of our lifespan respite funding for, to see what we could do to foster a systems change that is at the grassroots level, that it, encompasses and helps a wide group of people.
That is really exciting, and I hope as the consortium develops that they'll keep us up to date with their progress and what impact that's having in the state on expanding volunteer respite opportunities. It's very exciting. I love that whole idea of taking your experienced folks and using them as mentors for those who want to expand. It's a little bit of what we're hoping to do through this learning collaborative, but you've got it at the grassroots community level. I think that's going to be very, very telling and very useful to the rest of us. So thank you. I also wanted to know, and it's already starting to appear in the chat, if there are particular aspects of volunteer or faith-based programs that you want to learn more about and perhaps do a deep dive on. And I see Cheryl from Nevada has already said she'd really like ideas on how a volunteer program can be sustainable. And I think that across the board, those are questions that we want to be able to talk about. And we certainly will overlap with our sustainability learning collaborative, some of which we've had folks join the sustainability learning collaborative because they have identified volunteer respite as the one activity that they want to sustain. So again, there's overlap among our learning collaboratives, but it certainly is an issue I'm sure we'd want to discuss here as well. Any other aspects of faith-based or volunteer respite you'd want to focus on? Or do a deep dive on? We've got some great topics already. SIB shops, using the faith community. Doris's faith-based revival, respite revival. Maybe something on, are any of you, others of you considering using nursing students or social work students or other university students in providing respite, like Rhode Island and Colorado has done that in the past, a number of states. I think Wisconsin, I'm not sure they're on the call today, but I think they're doing some work on that as well. Would that be a topic people are interested in? Cheryl says yes, Nevada's looking into that. I know Nebraska's done quite a bit of work in that as well, in that area, and have some experience. Some other issues people are interested in is legal liability in the faith community. Liability issues are always of great concern as we move forward with volunteer initiatives. We could even bring in experts to talk about that if it would be useful to people. Start by reading, I think it was at a state sustainability summit in New York that was focused on volunteer respite a few years ago. I don't remember who it was, Doris, but the gentleman who came up said that the chapter we had in our volunteer manual was the best thing he'd ever seen around liability and risk reduction on volunteer respite. So I would urge some of you to start there if you've got liability concerns. It might be a place to at least get some initial information. South Carolina is already doing, they're in the preliminary discussions with their College of Nursing. That's exciting. Colorado wants to revisit using nursing students to provide respite in rural communities. There was another innovative and exemplary respite service that we know about at James Madison University here in Virginia that also uses student nurses to provide respite for children with special medical needs, and also a companion program also at James Madison that provides respite for older adults as well, using students, social work students and other students. So it's a growing model that has lots of potential. Also, if you snag a student early on in their program, it might be a volunteer that a family can rely on for 2, 3, or 4 years while that student is engaged at the university. So you're getting a longer term volunteer and retaining that volunteer to maintain the relationship with the family. We also have someone that we've been working with through our research consortium, Tiffany Washington, based at the University of Georgia. And she has developed a wonderful program called Home Builders, where she engages her social work students in a class on caregiving, but then also sends them out in the community to provide respite to families. And she's evaluated that program. So if any of you are interested in that, we could bring in Tiffany to talk about her home-based respite model using students. So if I see that there's an interest in that, that could be a topic as well.
Well, this might be a stretch, but I know a lot of fraternities and sororities have topics of focus areas. And here in Maryland, at Towson University, there's a sorority where their focus area is assisting people with autism and other intellectual developmental disabilities. And they were looking to volunteer to help. They were actually proactively seeking ways that they could help provide families with respite. Was rather interesting because, and I don't know how you find out what fraternities, but I know people, I was never in one, but I know people who were in one, in those kind of things, when they find their topical area. I mean, it's sort of a lifelong commitment. It carries over into post-college life. It's just thinking of your university things, but just a thought.
No, great, thank you. We only have a few more minutes left. I wanted to just touch on the ways that we could structure the learning collaborative going forward. All of our collaborators right now operate a little bit differently. The Sustainability Collaborative is a hardcore group of 5 or 6 states that meet monthly. And they primarily do a bring, brag, and borrow, because it's a small enough group that they can do that, where people provide updates on their activities around sustainability. And Susan Summers, the facilitator, will provide guidance by developing a discussion guide or bring in a resource and share that. But it's a very much a peer-to-peer learning type of learning collaborative. The Performance Measurement Collaborative, just getting started and run by Cassandra Furman. They've had individuals who are members of the Learning Collaborative do formal presentations and then engage in discussion around that. That's been a very successful effort. So we could do a mixture of that. We could bring in outside experts to do presentations. But I'm hoping at some point we get to the point where we're really, you all have developed so much experience and have so many resources to share that we can also ask some of you to do presentations as well, and not always rely on the outside experts, but it would be nice to have that option as well. Generally speaking, is that how you would all like to proceed? That we perhaps start off with one or two outside experts, or start off with some of you volunteering to do presentations on your respite and volunteer, your faith-based and volunteer efforts? I know I would love to hear about Alicia's program. I'd love to hear more about Doris's program. I'd love to hear more about any student-run initiatives. I'm getting some thumbs up. I think what we'll do, because we're running out of time, I will put together a list of some of the topics that we talked about today or that I saw in the chat, and then ask you all to prioritize them. And then let me know if you'd like to volunteer to do a presentation on the next Learning Collaborative meeting, or at least maybe one coming up in the next year, so that we can schedule you in advance. That would be great. If we meet for an hour and a half, we can set aside some of the time. Given that there's so many of us on the call, I think we probably got 30 or 40. I'm not even sure how many folks we have on the call today. We could break up, use breakout rooms to have smaller group discussions, maybe by region. So if you've got any thoughts on that today, I'd love to hear how you want to structure this, or just keep it loose and proceed with within network presentations for the next couple of meetings. Any ideas on structuring?
I love the idea of at some point break, not like it matters what but of yeah, smaller groups by region, or thinking like if you're working in urban, suburban, rural, frontier areas, or not all the time, but I think Lynn was saying, they work with the AHECs and health education centers, and those tend to be more rural oriented, that sometimes breaking into, like, we're in a very populous area, we're in a very sparse area, our church is, and then maybe some people are more focused on volunteers on a large scale, and maybe some people are really trying to hone in on working with the faith-based, like the question in the chat. The church, a lot of the faith-based groups are very focused on food security. How do we get them interested in respite, which I think is something that could be done, but there's just such a myriad of topics to talk about. Is there enough time?
That's the problem. There lies the rub. So many good
Exactly.
topics, and we're getting lots of good volunteers who would like to share their good work with us too. So that's really wonderful. I think initially, in order to be respectful of how much time you're already all spending in learning collaboratives, that we'll start out meeting quarterly. And if that's acceptable to everyone, if you'd like to meet more often, please put that in the chat and let me know. Maybe we could have a subcommittee of the group who wanted to meet more often on a specific topic, but we'll start off meeting quarterly and engage our network to share, and then see how it goes from there. And what I'm going to try to do, we've just done it with the Voucher Learning Collaborative, is select a day of the week that we'll meet every 3 months, and then get those dates on the calendar at the start of the year, so you're all aware of what those dates are, instead of always waiting till the last minute to schedule a meeting. I think given how many collaboratives we are running now, and we don't want them to be overlapping or all bunched up in the same week. So I'll try to propose a date and a time. If you want to put in the chat what day of the week is best for you, that would be great. Right now, our Sustainability Learning Collaborative meets on Fridays every month. The Voucher Learning Collaborative is going to meet the third Thursday of every month. Cassandra, what does your collaborative have a specific day of the week you're already meeting?
Thursday at 10 Pacific, 1 Eastern. And I'm
But
going to,
every 3 months though, right? So we have to
oh, yeah,
alternate
quarterly.
quarterly, yeah. Well, we could keep them all on Thursdays, but a different week or a different month.
Yeah,
No,
my
there wouldn't
next
be
one
this-
will
there
be in
wouldn't- we're not gonna have two
December.
collaboratives on the same day ever, or even the same month, hopefully. Okay, so we'll proceed that way. Again, if there's anything we didn't talk about today that you were hoping we would talk about, I'll leave this open for a little while and you can put it in the chat, or feel free to email me. My email address is at our website, archrespite.org. For those of you who are not familiar with how to contact me, you can find my email address on the website. Any other last minute thoughts or comments or hopes and desires and dreams for volunteer and faith-based respite? I'm very, very excited about this and really super excited to hear about what all of you are doing. So thank you all for being here today and have a really wonderful rest of your afternoon.
Thank you.
Thank you, everyone.
Take care.